Uh, Welcome, guys. Aloha. This is Dr. Tom coming back at you. I had to delete a ridiculous message that was on there. Okay, we left off with the thyroid gland, calcitonin. We said that the thyroid gland, along with the parathyroids, which we haven't studied yet, regulates serum levels of calcium in the blood. Very important. Basically, the thyroid gland moves it out of the blood. The parathyroid glands move it into the blood if it's getting a little low. Lie along posterior wall thyroid gland are most important regular blood calcium. They secrete parathyroid hormone, or PTH. Parathyroids raise it up, thyroid raises it down. Here it shows it here. Here are the little parathyroid glands. There's 4 of them. And this is just a repeat of what I said. Parathyroid hormone raises blood calcium in 3 mechanisms. One, by reabsorbing it out of bone. The bone is a massive storehouse of calcium. And by resorbing calcium ions from the urine. Don't let them go out in the urine, get them back. And by absorbing dietary calcium in the intestine. Vitamin D plays an important role in that. Guys, everybody in the country should be taking vitamin D. It's cheap, and it is vital to life. I don't say that about any other nutrient. It's that important. And the fact that the doctors are not telling people that is quite disappointing to me. Blood calcium imbalances. Thyroid gland secretes calcitonin in response to elevated. Calcitonin lowers it. Okay, this is just a repeat of what we said 3 times already. Okay, if we have an abnormal secretion from the parathyroid glands, well, if we don't have enough, they have hypocalcemic tetany causing carpal spasm, hypersecretion, hypercalcemia, bones, stones, moans, and groans. Remember, guys, calcium plays an enormous role in muscle contraction. So that alone, besides what it does in the bone, is of great, great importance. Okay, on top of the kidneys, add renals, see add on top of, there are two important glands called the adrenal glands. They have an inner medullary portion and an outer cortical or cortex. Each area secretes different hormones. The inner region, the medulla secretes catecholamines, which we'll talk about in a moment. The outer region secretes steroid hormones. Here they are on top of the kidney. The medulla, extension of the sympathetic nervous system, remember that? Fight or flight response increases heart rate and blood pressure, mobilizes body for emergencies. The catecholamines are, you've heard of these now, epinephrine and norepinephrine, also known as what? Adrenaline and noradrenaline. So the adrenal medulla is what secretes adrenaline or epinephrine. Okay, the cortex secretes steroid hormones. There's 3 or 4 of them that are important. The glucocorticoids, cortisol is the most important. It's a potent anti-inflammatory. It also deals with sugar. Aldosterone, which helps regulate salt and sodium balance. As you know, that's essential for nerve conduction. And it also plays a role with testosterone, sex hormone. Now, testosterone is a male hormone, but females have some also. ACTH is what stimulates the cortex. Negative feedback again, and of course, as before, it's controlled by the hypothalamus. So the inside, the medullary portion releases the catecholamines, adrenaline. The outer cortex portion, cortisol, aldosterone, testosterone. There's also some others, but glucocorticoids, gluco means sugar, and oid means steroids, steroid hormones with a sugar basis. Cortisol is important. Cortisone, guys, the famous drug they give for anti-inflammation, was derived from cortisol. It's important, but it can affect them. It can suppress the immune system, and it can also cause blood sugar problems. Aldosterone, again, is real important to maintain sodium and other electrolytes. Glucocorticoids affect carbohydrates, convert amino acids into glucose, which of course is called gluconeogenesis, help maintain blood glucose levels, affect protein and fat metabolism, burning both substances as fuel to increase energy production. That's if you have the need. Yes. Mineralocorticoids, that's how that's pronounced, and sex hormones. The chief mineralocorticoid is aldosterone. Aldosterone plays an important role in the regulation of blood volume, blood pressure, and the concentration of electrolytes, which is what I was mentioning. The primary target organ of aldosterone is the kidney. Aldosterone stimulates the kidney's reabsorption of salt and water and excretion of potassium. Remember, guys, the kidneys are such remarkable organs that they can selectively choose what to keep and what not to keep. And what not is kept goes out in the urine. Sex hormones, estrogens in the female, androgens in the male, but there's both in both. Okay, abnormal secretion of steroids. Hyposecretion, we have Addison's disease. John F. Kennedy, the president, had Addison's disease. It makes your skin bronzed, and I've said this before, but the press used to comment on how vibrant and dynamic JFK looked with his suntan, and it was actually, I don't want to take away from Kennedy because I have respect for him, great respect, but he had Addison's disease. Acute adrenal cortical insufficiency. Hypersecretion is Cushing syndrome. Those people are round, they have a round moon face, and they tend to be overweight. Okay, now we're finished with the adrenal glands, which is good, but it's actually a little more complicated than that, but that's the gist of it. The pancreas is the only gland in the body that's both an exocrine and an endocrine gland. The exocrine are the digestive hormones it produces. The endocrine are what we're going to talk about right now. Across the upper abdomen, aisles of Langerhans are the names of the cells that secrete the exocrine hormones. The alpha cells secrete glucagon, which is what this is supposed to say. Beta cells secrete insulin. We've all heard of that. All right, so really important. Pancreas regulates blood glucose. Blood glucose levels rise, pancreas secretes insulin. Blood glucose levels fall, pancreas secretes glucagon. Now, recall that glucose is stored in a polysaccharide form called glycogen. It's stored in the liver and in the skeletal muscles. Glucagon is what causes glycogen to be formed. No, it breaks down glycogen. I'm sorry, to release the insulin, release the glucose, as you were. So if the blood glucose starts rising, guys, let's say you ate a candy bar or a Twinkie, the pancreas will detect that and it'll crank out extra insulin to help. Remember what insulin does? It facilitates the transport of insulin across the cell membrane. Insulin cannot cross it by itself. Glucose can. It needs insulin's help. And then if blood glucose levels fall, the pancreas secretes glucagon, which frees up the glucose in stored glycogen form. Okay, in normal metabolism, carbohydrate, increased transport of glucose into cell, use of glucose as fuel, storage of excess glucose as glycogen, which we just mentioned. Protein, stimulation of protein synthesis, fat, stimulation of fatty acid synthesis. So insulin does all this. It's really complicated, guys, and diabetes mellitus is a real problem. Deficiency of insulin is called diabetes mellitus. Has devastating effect if left untreated. There's a lot of it in my family. I've seen some of the effects firsthand, and it's not fun. Insulin deficiency or ineffectiveness. I don't know if they're going to say this, but let's say it now. In type 1 diabetes, it's an autoimmune disease. It's also much smaller percentage of diabetics have type 1. The immune system attacks the beta cells of the aisles of Langerhans and destroys them, and these people are no longer able to make insulin. They are dependent on insulin for the rest of their life. The vast majority of diabetic patients, however, have type 2 diabetes. And they have, there's a strong genetic component, but there's a very strong lifestyle component also. The classic symptoms here are hypoglycemia, you have your blood sugar's too high. Glycosuria, what's that mean? You have sugar in the urine. You shouldn't have sugar in the urine. Until it reaches 160 milligrams %, it will not be in the urine. After that, it will. The classic symptoms, polyuria, you have to pee all the time. Polydipsia, you have to drink all the time because you're peeing all the time. Polyphagia, you're hungry. Acidosis, because of the breakdown of fats for energy because you're not able to process carbohydrates appropriately. Fruity odor to the breath, sometimes. Rapid fatty acid catabolism causes formation of acetone. Acetone is nail polish remover. I've always seen it, always it's described as that fruity odor. I don't see any fruity odor about acetone, guys. Maybe it's just me. Glucagon. Pancreatic hormone secreted by alpha cells of the isles of Langerhans. Remember, the beta is what makes the insulin. Primary action is to increase blood glucose levels. If it starts getting too low, or let's say you're out running a marathon or something, you're burning through that stuff. Other glands, the gonads, testes secrete testosterone. Ovaries in the female secrete progesterone and estrogen. The thymus gland, just posterior to the breastbone, secretes thymosins, affect immune function. Guys, the thymus gland is always said, it's atrophied in the adult. It doesn't play a role. That's a bunch of crap. The T cells of the T lymphocytes are trained by the thymus in a miraculous process that we don't understand. Okay, and then there's another mysterious gland in the endocrine system known as the pineal gland. It's deep in the brain. We still don't really know what it does. Secretes melatonin. Many of you have heard of that. I take melatonin, it helps you sleep. Affects biological clock. Adipose fat tissue secretes unhealthy cytokines, but I don't know right offhand what that has to do with the pineal gland. The metaphysical people attribute all kinds of special effects to the pineal gland. Other hormones. Organ-specific hormones secreted by organs such as the heart, kidney, and digestive organs. Yeah, the heart makes hormones, the kidney does. The digestive organs. Prostaglandins secreted by most tissues, most act locally. Play a role in regulation of smooth muscle contraction, inflammatory response, and pain. Now, what this is mentioning, guys, are the other hormones that are active in the body, but yet aren't produced by the classical endocrine glands. Adipose tissue hormones. Excessive weight secretes cytokines. Weight issues lead to problems with heart and blood vessels, diabetes mellitus, cancer, joint disease. 65% of the American population is either obese or overweight. It's sad, guys. I'm an old dude. I go way back. When I was a kid, you didn't see the fat people that you see now. There were fat people because my parents were fat. I was born into a fat family. But you didn't see the numbers and the hugeness of them like you do now. It's really sad. That's something we're going to have to get a handle on, guys, and I don't know how we're going to do it because it's something the patient has to do. And I don't know, guys, if you come up with a way to motivate patients to lose weight, let me know and we'll both become millionaires. A couple out of 100 will, but the rest of them won't do diddly. I don't mean to be mean. I mean, people eat for psychological reasons and for any number, but it's something you have to deal with. There's no miracle drug the doctor can give you that'll cure obesity. All right, we're finished. They want it to be badly, but there's not. The problem, guys, with diabetes mellitus type 2 is practically a pandemic itself. It's a real problem. It's grown tremendously over the years. And it's lifestyle related, guys. If you go to countries, third world countries, where they're still scrounging for food, you don't find diabetes type 2. However, if you go to a third world country where they used to scrounge and now they got food, it's now obesity and diabetes is off the scale. I used to work with a doctor. I don't remember, somewhere in Central or South America. And he told me, he said, Tom, you wouldn't believe the numbers of people with diabetes and going blind and stuff down there. It's just because now that they have a surplus of food, they pack it away. We're almost out of time. Never, ever underestimate the power of diet and lifestyle. I've been in the field a long time, guys, and I've seen it, and that's the key to health. Okay, this finishes everything for this module. I hope you will view this tape, and we'll see you next time. This is Dr. Tom signing off.